Tell me exactly what happened.
I don't know the lady, but she can't breathe very well. She's really gasping.
In Melbourne's northern suburbs, a worried member of the public has called emergency services after finding an 85-year-old woman struggling for breath.
Her lips are quite pale.
Is she clammy?
Yes, she's clammy.
Okay, so just organising some help for you. Just keep reassuring her, all right?
As a priority zero, paramedics Nicola and Risky know this case could be a matter of life or death.
An 85-year-old female struggling to breathe. Doesn't sound good.
No.
Priority zeros are the highest acuity cases we get dispatched to, so they're generally cardiac arrest, respiratory cases that are altered conscious state. It's basically people that are dying.
Clear left here.
Because the patient is so critically ill, multiple crews will be sent to help. But Nicola and Risky are the first to arrive.
There they are.
Respiratory jobs make me anxious. With someone in front of you that's struggling to breathe, you feel like you have to get in there and treat them straight away, whereas in actual fact, you need to do a proper assessment so that they actually have the best outcome.
Hello. What's your name? Marjorie. Marjorie, I'm Michelle. What's happening?
Just did some shopping.
Okay.
I know I couldn't breathe.
All right, so just relax your breathing. I'm going to have a listen to your chest, okay?
Worried bystanders called paramedics after finding Marjorie gasping for air at the wheel of her car.
The lady was tooting her horn, so we came over to see what was wrong, and she was struggling to breathe. She was in obvious distress, and she said, "Help me, help me."
Just nice and slow. It's okay.
She looks quite blue.
Yeah, I know. I'll get some O2 on it.
Marjorie's fingertips and lips being blue, that clearly means she's not getting enough oxygen.
But Marjorie's problems could have an even more worrying underlying cause.
When the heart fails to pump effectively, it has a build-up of pressure which pushes fluid into the lungs. And that's what I think that is happening with Marjorie today.
It sounds like full-field crackles.
Yeah.
Full-field crackles is a sign to us that the patient has fluid all the way to the top of their lungs, and she's essentially drowning from the inside.
Just focus on your breathing, all right? And just try and remain nice and still for us, okay?
Back in the northern suburbs, Risky and Nicola are urgently administering oxygen to 85-year-old Marjorie and have been joined by specialist Micah paramedic James.
Now, so do you have any heart problems?
Yes, I've got a pacemaker.
We've got a pacemaker.
With fluid-filled lungs and a failing heart, Marjorie's situation is critical. But before they can escalate treatment, they need to get her out of the car.
Any heart attack before? Yes?
We need to be really careful with these patients because the smallest amount of movement from them can tip them over the edge.
Just leave all that there for the moment, okay?
Don't want to put too much strain on the heart that's already under a lot of stress.
We're going to slide this under your bottom, okay? That's it. Now, we're going to slide you onto our bed, okay? You're right there.
Ready? 1, 2, 3. That's it.
Marjorie could go into cardiac arrest any time and urgently needs hospital care.
Is your breathing feeling any better with that on?
Not much.
Not much, okay.
But while she's made it safely to the back of the ambulance, for now, they're unable to take her any further.
Marjorie's one of the sickest patients I've seen, but before we can get her to hospital, we need to actually make sure that she's stable enough that she's going to make it all the way there, because at this point, without any intervention, she may not make it.
85-year-old Marjorie's lungs are filling with fluid, and her failing heart could go into arrest any time.
It's rattling in the chest.
It is, because it's fluid in there.
I'm going to put some tablets under your tongue, okay? Just lift up your tongue. That's it. And leave them there and just let them fizzle away, okay?
Medication will help lower Marjorie's blood pressure, but the team must get more oxygen into her lungs if they're to save her life.
I'm going to swap the mask over, okay? We're going to give you a bigger one. This one's going to feel a bit uncomfortable, okay? What this mask does is it has continuous pressure going into the lungs, which forces those air sacs open so you can get more oxygen being transferred into the blood.
How are you feeling, Marjorie? Is the breathing feeling a bit better? Okay, all right. Let's get going.
With the specialised mask forcing oxygen into her lungs, Marjorie's breathing stabilises enough for her to make the journey to hospital. But she's not in the clear yet.
Driving to hospital, lights and sirens with a critical patient in the back, I don't think I fully relax until I'm through those hospital doors.
That's really good. You're doing really well.
Elderly patients don't tend to bounce back as fast. So even though our management might be working, they're still critically ill patients. You know, there's still things going wrong, in this case, her heart. You know, you just hope for them that they can get better, but we know in reality that isn't always the case.
Marjorie will now be rushed to the emergency department for urgent treatment by cardiac specialists.
Nice flowers, I like these ones.
Carnations.
It's just 24 hours since Risky and Nicola were called to help 85-year-old Marjorie as she struggled to breathe at the wheel of her car. With a failing heart and fluid-filled lungs, the odds were against her making a full recovery.
Hi, Marjorie.
That ambulance driver.
There you go.
But Marjorie has proved to be exceptional.
How are you feeling?
Thanks, love. Oh, much better, thanks.
You're looking a lot better.
Oh, yeah.
Yeah.
There's no way I could breathe.
Yeah.
And I just felt all the fluid rattling in my throat and my chest.
Yeah, we could hear
I
it.
just couldn't breathe.
Marjorie's really lucky that all the circumstances came together as they did. I mean, she was on her own. She got short of breath. She didn't have a way of calling the ambulance herself. So to see her looking like this today is amazing. She looks like a different person.
Tests showed one of Marjorie's heart valves was faulty. If she hadn't alerted passers-by as she did, she might not have survived.
You were the sickest patient we've been to for a while. You were really unwell.
Oh, well, that proves you can do it. You can do miracles.
But you helped yourself as well by tooting the horn. So if you hadn't have tooted the horn, Marjorie, you know, things could be different. So good on you as well, yeah?
Right.
Yeah.
I try to be a bit sensible sometimes.
So as much as respiratory patients scare me sometimes, seeing Marjorie sitting up with a big smile on her face was such a satisfying moment. To know that she's actually continued to get better, that's a sense of achievement. You know, that's what we joined this job for.
Thank you, Marjorie.
You're doing a really wonderful job. I'll never forget your kindness to me.
Glad we can make a difference.
You certainly do.